All right. Let's turn now to Congressman Bill Cassidy. He is a Republican from Louisiana. He is also, we should mention, a doctor. And Allison Schwartz, a Democrat from Pennsylvania. They both join us now from Washington, D.C. Good to see you both. So, Congresswoman Schwartz, I'll go to you first. The words of Max Baucus essentially saying that no matter what you want and what other liberals want in the Senate and the House, a public option cannot pass the Senate. What do you think of his remarks?
Well, let me say, we have really put together what I consider a very moderate bill. I'm going to hear more about it tonight from the president. We really wanted to really meet the real concerns of the American people, our families, our businesses, and yes, the country in terms of the insecurity they feel about their health coverage. You were just talking about that. And of course, the uncontrolled rising costs of health coverage for families and for businesses, and of course, again, for the whole country. So we're going to take action. And this is a bill that really does incorporate the very broad view of different Democrats. There's no question about that. Well, as you point out, we have some more conservative and some more liberal Democrats, but we have really tried to find that common ground. We were hoping for some
hold on
help
one
from
second.
the Republicans. They haven't come on.
I don't think.
But that's where we are.
I don't think that Max Baucus would consider himself to be a conservative, but he doesn't think public option is going to pass.
Well, he is still trying to build a 60-vote margin, maybe even larger than that. And look, understand as you do that the public option is just that. It is one of the options that people, particularly those individuals and small businesses who have the hardest time finding affordable, ongoing health coverage in the private marketplace. It's going to be an option for them to choose. It's their choice. We hope that it will be potentially lower cost because it's nonprofit. It doesn't have to have those big margins for overhead and profit. But again, no one has to choose the public option, but it's there. It provides some competition, provides some choice, and in many markets across this country, there really are not a lot of options.
Understood.
So
but
I believe it's a good way to bring that cost down.
Okay, let me give you a Republican a chance to weigh in. Dr. Cassidy, the fact is that when you hear Max Baucus, who after all is not recognized as a conservative Democrat, when he comes in and says forget the public option, sounds like you folks who were against it from the beginning just won.
Well, the American people won because hundreds of thousands of people in town halls across the country registered their objection to what they saw as more government in their life. Now, clearly, if we're here to represent the American people, they should be listened to. I think the question in the speech tonight is that the president spoke as the president heard. I think so. I don't think he would be here before us if he had not at least known, as you put, Dave, they struck a chord. Max Baucus has heard, and that's why he's taken the public option out, which most American people do not see as benign as my colleague does. They rather see it inevitably leading to a single-payer system, and frankly, most liberal Democrats feel that same way if you view their YouTube moments.
Well, and Congresswoman Schwartz, I'm looking at some of the polls, and they're all consistent in the fact that they report that the more American people hear about the public option, the least they like it. And now, by 52%, the American public are against the public option. So you're not winning the debate.
Well, let me say this. There's no question in the end of the month of August where many of us, both Republican and Democrats, went out to talk to our constituents. And many of us tried to talk about what's really in the bill and, of course, to listen to our constituents as well. And they've been told a lot that is scaring them into all sorts of government control, which I'm sure the president will also speak about tonight, is simply not true. So the point here is...
Well, there have been some untruths on both sides of the aisle, in fairness, Congresswoman.
You know, there has been a deliberate effort, obviously, to make sure that Americans are scared by things that are not in the bill at all. And, you know, we know that. And once people are afraid, it's hard to actually talk about the reality and the truth.
But Dr. Cassidy,
you know,
we have heard untruths on both sides.
Right.
I mean, frankly, when the president came out with his town hall of his own, he said that the AARP endorsed his plan, which they hadn't. He said there would be no coverage of illegal aliens, even though a good number of those 47 million uninsured are illegal aliens. So if he wants to cover them all, he's got to cover some. So there are a lot of untruths on both sides of the aisle, aren't there?
Well, let me say,
Hold
we
on,
do have to
Dr.
listen
Cassidy,
to...
you've had your speech.
Go ahead, you go
ahead, Dr. Cassidy.
One thing I can say is that the American people actually read the bill. I went to a meeting in Ascension Parish. A fellow who was not in health care had read all 1,100 pages. So there was enough in there to scare them, regardless of what might not have been in there that was perhaps thought to be so. And what the American people knew is that this is going to cost $1 trillion more in the next 10 years. Congressional Budget Office predicts an 8% inflation rate in the out years, which means that it more than double cost every 10 years thereafter. By the way, the president says status quo doubles cost. This reform package, according to CBO, more than doubles cost. The American people understood that. They understood it was government-based, not patient-centered. I think the American people have spoken. They did read the bill, and by golly, they were upset with what was in it.
All right. Well, folks, we hope you enjoy the president's speech tonight. We started with Congresswoman Schwartz. We'll end with Dr. Cassidy. Thank you both for coming. Appreciate it. So, who will President